Welcome to Beyond Reality, where we talk about clinician journey and breakthroughs in virtual reality rehabilitation.
Today we are joined by Dr. Katrina Banks, the owner of Neurologic Optimal Wellness Physical Therapy Clinic. Welcome, Dr. Banks.
Thank you. I'm so excited to be here today.
Thank you for doing this. We are excited to learn about your journey, how you started your clinic, and also how you're using, VR technology to help your clients. So we'll start off with, would love to know a little bit about your background and what motivated you to pursue a career in therapy.
So how did I get started with physical therapy? So I actually got introduced to physical therapy back in high school when my aunt had a stroke. And I was really interested to figure out what was going on because she had right-sided weakness, and I didn't understand at that time like what was going on with her brain. And I started going to her sessions at rehab and just got to learn from the physical therapist that she was working with how they were able to help her manage to be able to walk, be able to get around, to be able to communicate, and be able to get home from rehab. And it just really was awesome to be able to see those transitions and how she got from one point to being able to go home. And it was amazing just to see that. And I also had, back during high school, a chance to just like shadow a physical therapist. And I just got to learn more about how their day went, what type of patients they were working with. And it was just something that I was like, you know what, I really want to be able to help people in a meaningful way and be able to change their lives.
Right.
So
I love that. I mean, there are these defining moments in your life that, change everything. You're able to see in real time how your aunt got better, and you're like, you can do this too, and you can provide help to lots of people that need it. How is your aunt doing today?
Unfortunately, she passed away a few years back.
Okay.
But she was able to go home and be in her environment, which was awesome because most people thrive when they're home versus being in a rehab facility. So it was just a blessing that they were able to transition her from rehab to home, where she was in her safe environment and able to enjoy her quality of life there.
Right. That's great to know, and I'm glad now you're helping others in this journey. So on that, how did the idea of starting your own physical therapy clinic come about? Was that the defining movement where you become a physical therapist and start your own clinic, or it was later on?
It was a little bit later on. So I thought, when I started my PT career, that I was gonna love my 9 to 5 or 7 to 5:30 job. And I noticed, sometimes when you work in a different facility, your expectation for productivity can be a little worrisome, where you got to see 15 to 20 people in a day. And I felt like I wasn't able to really use my skills that I had learned and be able to implement it with clients that I was seeing.
Right.
The other thing, even with productivity being an issue, I noticed I did some traveling physical therapy for 5 years. So I was able to move around and check out what other colleagues were doing across the country. And I kept running into my neuro patients not having anywhere to go once they left the hospital system, being discharged. They would either go to just a regular physical therapist, and I'm not knocking our physical therapists, but they were going to people that weren't really well versed in neurologic, treatment, or they weren't going anywhere once they left. So I kept seeing that over and over when I was discharging people. And I said, you know what? I really think I need to create my own little business to start so that I could actually cater to this population, be able to listen to their concerns, and also be able to really provide quality care, where I'm not seeing 20 people in a day, where I can see you one-on-one and really listen to what your needs are and be creative about it and make it fun.
And give them that time that will really, change probably their progress and the functional abilities that they can reach by just giving that time and the creative aspects of therapy.
Exactly.
That's amazing to know. Thank you for sharing that with us. So
you.
coming to clinic ownership, so what have been the most rewarding aspects of owning and running your own practice?
I think the most rewarding aspect is just being able to provide hope to individuals with neurologic disorders,
Right.
especially progressive disorders, and being able to change people's lives for the better and educating them on their diagnosis, being able to allow them to realize that they can do more than they thought they could. That is like a big game changer for me when they're like, yeah, I can't get out of this wheelchair, and they're able to stand and walk across the room because somebody prior said, oh, you'll be in a wheelchair. And it's like, no, let's see what you can do for yourself. Let's guide you. Let's use some techniques that are going to be helpful for you. And let's see your potential. And it's
Right.
just amazing to be able to just see that in people.
Right.
No, I had a client that I started my business actually during the pandemic. So
Mhm.
I had to kind of change my model because I was thinking brick and mortar and everything was closed down. So I
Right.
was literally going to people's homes and seeing them in their environment, which was great during the pandemic. And I met a gentleman who was wheelchair bound. He had had a stroke like 5 or 6 years prior to me seeing him. And he was just in a wheelchair. He needed help with standing. He needed help with
Right.
getting to the bathroom. And this gentleman has been working with me since I started the business in 2020. And he's
Oh, wow.
walking with his walker. He can
Right.
get to the bathroom. He can shower. So just being able to change people's lives in that way has
Mhm.
been amazing. That's been a big, big, huge accomplishment for me as being a business owner.
That's amazing. I mean, it's so rewarding to see that happen, and I'm glad that client is still with you. And we've seen that too on our side, doing working with rehab patients. That it's sometimes it's the bias of this is what they're told that they cannot do, and they kind of stick to it. But if you really like open up those doors, you'll see their functional levels are totally much higher than they might be thinking. And we've seen that happen over and over again too. And I'm glad that you're recognizing that, and kind of uh, progressing towards independence for most of them.
Absolutely.
Yeah, yeah,
Everyone deserves a chance. That's
right,
always my motto. Everybody deserves a chance. Even it may not be perfect, but if
right.
it changes what you can do and want to do, why not go for it?
Definitely. You're changing lives. Thank you for doing that. Now, I know, you're, an African American woman having your own clinic. I'm sure there are places that you might have overcome, there's adversity. So I also want to know, what are the challenges of, being a clinic owner, and it'd be nice if you're able to like share a story of overcoming adversity in running your practice, and maybe a lesson that taught you, or maybe how it made you more resilient and navigating through this process. Yeah.
I would have to say I'm definitely in the minority as far as being a physical therapist and being a entrepreneur as a business
Right.
owner.
Right.
I have to say that the things I face is the negative talk of like, oh, well, that's not going to work. You're working with neuro patients. That business is not going to thrive because most orthopedic clinics, they see 3, 4 people in an hour, and that's how they're profitable. So I've asked some of my colleagues, wanting to get some insight from them, and sometimes you get those answers like, "Oh, that's not going to really work. That you're not going to be profitable." And it's like, you know what? I think I can do better. I
Right.
don't have to listen to what
Yeah.
they're saying because they're not in my shoes right now. I'm the one here running my business. I'm making
Right.
it work. And I kind of just had to, it wasn't hurtful, but at the same time, I'm like, you know what? There's a reason why I'm doing this.
Right.
And I have to push forward and make this work and figure it out. And that's exactly what I've been doing the last 4 years. So yeah, I get some hurtful comments about, oh, why are you, doing neuro? That's not profitable. Or I have people questioning my credentials at times. And it's like, it's all there. I have nothing to hide. There's
Right.
not a reason why I wouldn't be providing services and it not be true. Like, yes, it's hurtful, but at the same time, I know what I'm bringing to the table, and
Yeah.
I don't have anything to prove. My proof is my clients when they're doing well and they're
Exactly.
having. So I don't try to let those things get to me. Yes, it's hurtful, but I've been able to navigate it and just keep my head high and keep going forward, honestly.
And it shows, right? You started your clinic in 2020. You're still here, and you're
Yes.
growing. So there you go. You the proof is in the pudding. There you go.
Absolutely.
Yeah. Awesome. So coming to your clinic, how do you differentiate your clinic from others in the area, and what unique services or approaches do you offer your clients?
So I am quite a unique physical therapy clinic. I think I'm the only clinic in my area that really focuses on neurologic disorders.
Okay.
I do a lot of one-on-one. I might sometimes see 2 people in an hour depending on what's going on, but most times I'm one-on-one with my clients. And I'm also picky about who I work with. So I kind of do this discovery session on the phone where I actually ask clients, how they're doing, what their physical therapy needs are, what are they looking for, are they willing to come in and do the work? And I kind of look forward to looking or just feeling what their vibe is. Are they really interested? And that allows me to really choose who's going to be a best fit for us. I want to work with people that are willing to do the work, that are enthusiastic, that I can encourage that they can do better. I don't want anybody coming in here that is negative. Oh, I don't think I can do this. So I'm really picky about who comes to the clinic.
Right. And that's when you see the progress, when they're motivated and you're working together, and that's you're forming a relationship to help them to get to that next level.
Absolutely. So I do focus on my clients. We have sometimes we're just looking at MRI reports, we're looking at educational things, we're talking about their diagnosis, how it's affecting their lifestyle. I'm more holistic as well. We're talking about diabetes, we're talking about heart disease. Are you eating well? Are you sleeping? Because we need to know those things for you to be able to do better for your lifestyle. So I'm very holistic. I like to get to know my clients. And I do focus on a lot of neurologic disorders. I have people that come in with orthopedic issues as well. I'm happy to see a shoulder or a knee, but majority of my patients are or do have a neurologic disorder. And what makes it different is I have this lovely virtual reality headset that has been amazing, in which I really can challenge people as they're in the community, which is really awesome.
Well, I'm glad you brought that up. It's a good segue into my next question. So we wanted to know what inspired the idea to introduce virtual reality into your clinic, and maybe how has it transformed your clinical care? It would also be nice to know maybe 1 or 2 clients that you worked with and their feedback and how it might have helped them.
So what inspired me? I'm always reading and looking into the physical therapy industry to figure out what's new, what's going on, what should I be diving into, what can I implement in my clinic? And virtual reality was one of the top ones. And so I did some research and I looked at some articles, and it just basically summarizing that virtual reality was very, very beneficial to stroke and traumatic brain injury patients. So I was like, you know what? That is something I think I want in my clinic. I reached out and I finally got the headset, and I've been using it with pretty much my Parkinson's patients, a traumatic brain injury that I'm working with, and a stroke patient.
Okay.
And I love it because, for example, I can put them at the lunchroom and work on their balance, work on their standing balance, work on their ability to reach, their ability to follow directions. So that cognitive component is amazing. The ability for them to count money, that type of thing. And it just really puts them as if they're out in the community at a cafeteria, which is awesome. My Parkinson's patient loves it. He literally asks when he comes in, are we gonna do the lunchroom today?
Oh, that's
and it's really cool because I get the virtual reality actually provides data for us so that I can tell how long it took him to do a certain task, and I can compare it when we do it again, if he's getting better or not, and implement that into his treatment plan. So it's been amazing. My stroke patient loves it. I kind of used it more for seated balance because he was having trouble sitting. So
Right.
his ability to, lean to the right, weight shift to the right, or weight shift to the left,
Got
and
it.
be able to, get away from cannonballs, but eat chicken wings. It's been amazing.
I think it's part of that holistic approach that you were talking about, right? You're going in the lunchroom, you're working both on the cognitive aspects and also the physical therapy at the same time
Yes.
with your patients. And it's like, uh, you know, it's really slotting in well with the theory and your thesis of your own clinic. I'm glad to hear that.
Yes, a great addition, I have to say. And everybody that I have tried it with, they love it. They're like, oh, nobody has this. Again, I think I'm like the only person in the area with it, but it is a great addition to the clinic. And I just love seeing people light up and they're like, all right, we're doing virtual reality today.
That's
I'm like, yeah,
amazing.
let's give it a try. And it's just really good because I try to make sure that what we're doing in the clinic makes sense for what they need to do in the community. And that's
Definitely.
what virtual reality does.
And yeah, and on that note, I would also like to know, like, when they put on the VR headset for the first time, what is the response that you get from your clients? And like, and you already spoke a little bit of the positive outcomes. It'd be nice to know a couple more. Yeah.
Yeah, so when they first put it on, they're like, oh wow, what is this? And
Okay.
they're like, oh,
Right.
this is really cool. What are we doing today?
Nice.
So I have another Parkinson's patient. She was very nervous at first because she's like never experienced putting on virtual reality goggles. So I
Which is a
started
lot
her,
of the population, especially maybe like the elderly population that you might be working with.
yes,
Yeah. Yeah.
but I started her in sitting. So I kind of gave her an activity to do seated, kind of working on weight shifting. And then she got used to that and she was like, you know what? I want to try this in standing, which was what I wanted in the first place.
Okay.
Anyways.
Right. Right.
So it was nice to be able to progress her. She got comfortable with it
Mhm.
and she loved it. I think I have a couple of videos I need to kind of post about it because I've been trialing it with a lot of people in my clinic and they absolutely love it. I don't know. They smile when I'm bringing it out. They see it on the desk and they're like, oh, we're doing this today.
That's
It's
amazing.
really cool.
Right.
It really is. You gotta
And then
have,
you're transporting them to these different worlds that they can, sometimes hang out in and then do their therapy also. So I'm glad that it's bringing joy to your patients too.
absolutely.
Awesome. Is that also helping you like emotionally connect with your patients through virtual reality, or it's impacting the overall atmosphere of your clinic?
I would think it definitely helps with the emotional component of it because like there's some people that want to get back to driving. So we work on the reaction time on there, Yeah, it's not part of my realm of what I do, but it's like, hey, let's see where you are so that I can refer you to that OT to do your driving test. You know what I mean?
Right.
So
Right. It's
I
also
think
kind of expanding the services
Yeah.
that you could provide. Okay.
absolutely. And it's just, it just allows these people to gain confidence
Mhm.
that they can go to Starbucks and buy coffee and be able to count to change at the same time. You know what I mean? I
Right.
always like use that example because I'm like, this is what you do in the real world.
Right. Exactly.
Put on
That's
your
amazing.
goggles
Mhm.
and you're not at PT clinic right now. You're at the grocery store.
Right. Right. And then just
Absolutely love it.
and practicing everything that you might have to do in that grocery store like really helps you, yeah, definitely build that confidence for
Absolutely.
everyone. Awesome. Do you think the addition of virtual reality technology to your clinical practice is attracting more clients to your practice?
I think as people learn more about it, it's definitely going to attract more people. Right now, I've been introducing it kind of within the clinic. I need to market it a little bit more. It's on my website, but I need to market it a little bit more. So I need to show some of the videos that I'm,
Yeah.
looking at the clinic with patients so that people are aware of, yes, we do offer this, and yes, this could be helpful for you in your daily life.
Definitely, and we are happy to share the videos on our social media channels too.
Awesome.
When you share it on yours.
Thank you.
Yeah, no, thank you so much for that. So now, coming back to a couple more questions about your clinic. So, for aspiring clinicians or individuals who are considering opening their own practice, what advice would you have for them based on the experience that you've had, running your own clinic for several years now?
I would definitely say do your research, talk to other clinicians that are already in business, talk to clinicians that are also aspiring to be business owners, because it's nice to get their perspective as well, and also to learn the ropes of their journey. And that's kind of how I kind of got started. I kind of went to a conference and I was around PTs that were already business owners. I got to pick their brains about how they were doing, what their approach was, what was their model. And I always also say, get a coach. You need somebody to hold you accountable, someone that's going to give you a checklist of things to do to kind of start your business. You got to have a business name. You got to register with the state. You got to make sure you're registering for a bank account. So have an attorney. Those baseline things, you need somebody to kind of guide you along the way, make sure you're checking off all those boxes to get started successfully. So I have a coach. I talk to people in my industry. I have a lot of friends across the country down south that I always phone in. We talk about different things.
We're in the south.
Yes.
Right.
But it's just nice to stay connected and
Definitely.
ask questions. Don't be afraid to not ask questions. If you're unsure about something, somebody's gonna know the answer, or they're gonna help you find the answer.
Right.
Don't be afraid. Take the step to business ownership
Right.
when you're ready. Don't do it because everybody else is doing it. Do it when you're ready, when you feel it's a good fit for you. And just make sure you have support. You need mentorship, you need coaching, you need people to guide you in the right direction.
And I love that because, having these mentors and advisors around you, you can, get to that advice that you need quickly, so instead of you figuring it out on your own without having all the context, all the information from that years and years of experience that they might have gone through. Right. So, learning from others' mistakes so that you don't have to do them. Yeah.
No doubt about that.
Yeah. Cool. Is there anything else you'd like to share with your audience, with your journey, your clinic, or the impact of VR in, the physical therapy field, or where you think it's, going?
I have to say that I think people underestimate physical therapy. I think based on some people's experiences, their perspective is a little bit off based on what we can actually offer to our clientele. So I want people to understand, I think we have to do better with educating the community on exactly what we do and to kind of change people's perspective on how we can change their life. Right. Because sometimes I get compared to a PC they saw 5 years ago, and I'm like, well, I'm not that same person. I'm not that person. My clinic approach is very different. And, there's a chance that you could go back to church, get back to walking up the stairs to go to church based on what I can help for you to do. So you want to find somebody like myself that is going to invest in you, and that's going to be able to listen to you intently, be able to be creative with what your needs are, and push you just enough to make sure that you're doing what you need to do to make that rewiring of the brain work so that you can have a quality of life. And if you have someone with virtual reality, it's a plus.
Exactly.
Literally will be in a different world, but still working on functional tasks that you need to work on in the community.
I love
and
that.
I'm so grateful for this opportunity, Vina, in regards to allow me to just speak about virtual reality and my background. And I'm just grateful for this opportunity. So thank you.
No, thank you. Thank you for taking the time and, jumping into VR and using it. And we need clinicians like you who are looking to the future and looking to how do you engage your patients in a different way and bring that creative modalities that you're talking about. So, we are here because of you. So thank you for that.
Thank you.
Obviously you have an amazing clinic, amazing journey. So if somebody wants to contact you, what's the best way to get in touch?
You could contact me via my website. Most people look at my website, so it's www.neuroptnow.com. You can call my business at 413-318-4776. You can find me on Instagram under Neurologic Optimal Wellness PT, or under Facebook, which I think my underscore is Neuro PT Now on Facebook. So there's multiple ways of reaching me. I look forward to anyone that needs help and want to get better. I'm definitely here and willing to change your life for the better.
That's amazing. I'm sure everybody who's here today, if they need help, they will definitely have to connect with Dr. Katrina Banks. So thank you so much for your time today and doing this and all the work that you're doing with patients. So thank you again. And
thank you so much.
Thank you for watching Beyond Reality podcast. Try our demo now at neurorehabvr.com to learn more about how you can enhance rehabilitation with virtual reality.